Tongue-tie journey class is now in session. Let's get started. I know what you're thinking, and it's probably, why would I want to take a class on tongue ties? Because, hear me out, the tongue, the fascia that connects the tongue is connected all the way through the body to the tips of the toe. So it affects everything in your body. Aches and pains and tightening, all of those sort of things, that forward head posture, all of it are affected. So that is why you need to sit up and take notes. You know, when I was in high school, I took an aptitude test and it came up with 3 things. It said I could be, four, an actress, a singer, a doctor, a teacher, and a therapist. And I was like, you know, I was one of those people, I'm like, a teacher, like those who can do, those who can't teach. Well, boy, was I wrong, because you know what? There is nothing better than being able to teach and share what you know. I have my results from my C-scan. I walk into the appointment with my doctor, and my myofunctional therapist was there as well. As soon as I walk in the door, she says, "Well, Vanessa, you are the champion of the small airways." I looked at her kind of odd, and I'm like, "What does that mean?" I'm like, is that a good thing, or is it? I didn't understand what it meant. And she says, "No." She goes, "Your airway." She says, "We're going to go through the results," which I have. I want to show you. I'm going to show you everything that we found from the C-scan. But she said, "Your airway is the smallest I have ever seen on any patient." And so I said, "Even children?" And she says, "Yes," because it's really like the size of a pin. So we're going to go through what my results actually are. Start with the sexy stuff. The prenasal sinuses. I have mild mucositis and small mucus retention, pseudocyst, are seen in the maxillary sinuses. So then says something about the osteomedial complexes are patent. So then, of course, my myofunctional therapist says, "You are using the nasal spray, aren't you?" And I said, I didn't get it yet. But then I said, "Okay, I'll start using the nasal spray." She said, "You need the nasal spray." This is the nasal spray. We'll talk about this in another video, but it's the X-Clear Natural Saline Nasal Spray. And now I'm using it in the morning and in the evening. To the airway. It says the minimum oropharyngeal airway. I know I butchered that. It's just the area that I'm breathing, my breather hole back there in my throat. The area is 9.6 mm. But what does that mean? What does that mean? Well, here's what it means. So we've got this little chart over here, and it has a cross-sectional area. Don't really know what that means. And then it has OSA probability, which would mean like an airway, breathing, or sleep apnea sort of issue. If you're a 52 millimeter size area for your throat, you have a high probability at 52 millimeter. 52 to 110 is a medium probability, and 110 is a low probability. I'm at 9.6. So high, it's like it's done, it's there. It's basically, as my doctor described it, literally like a pinhole. And she goes, and that is, you can see it here, this is my airway right there. You can see it right there. And when you lay down, that 9.6 millimeter gets even smaller when you're laying back. She said, "Do not sleep on your back." Goes against all the beauty suggestions, which is you lay flat on your back, which is really hard to do because I'm a side sleeper, because you don't get the wrinkles, and they say you're supposed to sleep better, but not good for a small airway, especially if your tongue rolls back. You know, it's really, and if you have sleep apnea, it's a real no-no. So no more sleeping on the back. TMJs, so the left condyle has a small vertical and anterior-posterior dimensions compared to the right. So obviously we knew that there was, issue on this side versus this side. No erosions are seen, but something associated with subchondrial sclerosis. And then we have both of the condyles. Oh, those are those little, you know what? Condyles are this. These are the condyles. These are these little area, which is kind of like right there at the jaw. Those have been worn down, and they're angry, if you will, because my jaw is not, my mouth, all of it, it's not even, so one side's compensating for the other. Have on the cervical spine, mild degenerative changes as seen portrayed, with the cervical area. And then we have something on my brain. We get to the brain. On my left TMJ, it says, the position of the condyles in the fossae is suggestive of internal derangement. I always knew I was a little bit cuckoo. This is my brain. This is my brain. And look what they found. Look at that. They found it's a bone bit there, and I can feel it. The other day I was like rubbing my head, like it's right there. I'm like, what is that? Why it's not even, like, I feel there's a bump there, and it's called axial sagittal and coronal sections show a bone exostosis on the surface of the right temporal bone. Now, I freaked out, but immediately she says, don't freak out, it's benign. Get rid of it. And she says, generally you leave it alone. I mean, some people can't get it cut out, but that would be, I'm like, I'm not getting it cut out. Does it grow? And I've done a little research, and I can't see, I guess maybe it could grow. I hope it doesn't grow. I hope it doesn't grow. And then it says the remainder of the scan is unremarkable, which means good. So those are the issues. And then we made a decision for sure that we're going to go to California I can't recall the doctor's name. We're going to see the doctor in LA, the specialist from the Breath Institute. Is Dr. Zaghi? I think it's Dr. Zaghi, because my case is clearly much more complicated than just a straight tongue tie. Thoughts. One is, I have to burp. So sorry. Oh, anyway, it is a really good thing that I did make the decision to do the expansion, because the doctor is like, look, Vanessa, if you, with the airway as tiny as your airway is, and not having the space for your tongue, getting the tongue tie really could be, you do risk getting, having problems after you get a tongue tie release if you are not addressing all of these things. Now, hopefully, with the Candid RX Pro, which is the mouth expanders, that is making more room in the mouth, which makes more room for the tongue to sit down where it's supposed to sit in the mouth and give me more space in the airway. And they have found, the doctor showed me these videos, that they have found that after the Candid, the expanders, that people's airways have expanded a little bit. So I'm crossing my fingers that happens for me. And because I've never felt like I've always felt like I had to kind of catch my breath, but I never felt like I had like a tiny air hole. She said, yeah, it's really like you're sucking through like a cocktail straw. You really aren't be able to get the airway. And so of course I asked her, I said, well, how about what size is your airway? She said, oh, my airway's fine. And I got mad. Then I got really mad. I was angry. I even swore a little bit, not at her, but at our medical system. PO'd, trying not to swear, PO'd, because the fact that there are so many people that need this, but don't have insurance. First of all, much of this isn't even being covered by insurance, but they don't have dental insurance. And guess what? Everything starts in the mouth. Everything starts in the mouth. And the fact that there are so many people out there that are getting sick and can't get it taken care of because they don't have dental insurance or they don't have medical insurance. But more importantly is that I'm mad that this is a surgery. These are issues that can land you in the hospital, that can, that are surgery related. Medical and dental need to be one kind of insurance. It makes me mad that it's not that way. It makes me angry, so that I want to go talk to Congress. It is not right. But I have to tell you this little story. So even my doctor said to me, she goes, I have a patient, came in, he has 2 abscessed teeth. Insurance won't pay for it. They will pay for him to go in the hospital, which he will land in the hospital if he doesn't get these teeth out, but they won't cover to get those teeth out. Something's messed up with the system. Okay. So my point in all of this is, I'm sharing my journey with you, but I want to help other people. I want more people, if they have issues with their mouth, with their tongue tie, any of that related, I want to help people get the relief that they need. And I don't want money or lack of insurance to be in the way. I don't know what I'm going to do or how I'm going to do it, but this is a hill worth dying on. I've got some tongue tie exercises calling my name. So until the next video, which is coming soon, take care. Thanks for listening to my journey. And if you've got tongue tie issues, let's be friends.